CDC. Vaccine philosophical differences driving up U.S. measles rates. CBS News. cbsnews.com/cbs evening news/cbs this morning/48 hours/60 minutes/Sunday morning/face the nation. Video. U.S. World. Politics. Entertainment. Health. Money Watch. Sci-tech. Crime. Sports. More blogs. The feed battle round the WH Web Show 60 Overtime Face-to-Face Resources Mobile Radio Local. Log in, join cbsnews.com, sign in with profile, manage my newsletter subscriptions, update my email address, change my password, log out. By Ryan Gislo /CBS News /September 12, 2013, 3:01 p.m. CDC. Vaccine philosophical differences driving up U.S. measles rates. Play CBS News video. Measles was declared eliminated from the United States in 2000, but anti-vaccination beliefs may be playing a role in bringing the disease back, a new government report suggests. The Centers for Disease Control and Prevention investigated more than a decade's worth of data on measles cases, including 2013 cases through the end of August, and found that most patients had not been vaccinated. Measles is a respiratory disease caused by a virus that spreads through breathing, coughing and sneezing and causes a serious rash and fever. While measles is harder to come by in the United States, the CDC notes it's still a worldwide public health problem that can be brought over to the country and spread to Americans. Measles can also result in serious complications including ear infections, pneumonia, and brain swelling, or encephalitis, which occurs in about 1 out of every 1,000 cases and may lead to death. Dr. Roy Samuels, a pediatrician at Cohen Children's Medical Center of New York in New Hyde Park, NY, told CBSNews.com in an email. One CDC expert pointed out that the measles infection can linger for 4 hours even after the infected person is no longer in the vicinity. 8 photos. Measles, 7 things parents must know. Clusters of people with like-minded beliefs leading them to forego vaccines can leave them susceptible to outbreaks when measles is imported from elsewhere. Dr. Han Shachap, director of the National Center for Immunization and Respiratory Diseases, told reporters Thursday during a teleconference. This is an extraordinarily contagious virus. Such clusters included people with similar religions, those with large extended families, or even certain school districts where vaccine rates are low. So far this year, 159 cases of measles were reported in 16 states, with 3 outbreaks accounting for most of cases. Outbreaks in New York City 58 cases, North Carolina 23 cases, and Texas 21 cases. That's on track for the most cases since measles was considered eliminated. Fortunately, said Shachap, nobody has died. 82% of cases were in unvaccinated persons, and 9% were in people who weren't sure if they'd been vaccinated. 79% of those the unvaccinated cited philosophical differences with the measles, mumps and rubella MMR shot. The CDC said recent misinformation about the measles vaccine, including a since-disputed link to developing autism from vaccines, may still be influencing some families. Shachap called on pediatricians and doctors who have close relationships with these families to convince them otherwise. In recent years, some pediatricians have even fired patients if parents won't get their kids vaccinated, citing risks of infecting other kids in their practices. The new measles report coincides with the CDC release of the National Report Card of Vaccines in infants aged 19 to 35 months. This year marks the 20th anniversary of legislation that created the Vaccines for Children program, a federally funded effort to provide no-cost vaccines to kids whose families can't pay. The program was first launched to combat the national measles crisis in the late 1980s, Shachap explained, when a vaccination gap was evident in preschoolers who would get turned away from pediatricians because parents could not afford shots, only to be referred to a community health clinic where the families might not show up. Texas battling whooping cough epidemic, doctors say back-to-school plans should include flu shots. New flu shot broadens protection against 4 strains of virus. For the report card, almost 17,000 families were surveyed by random phone calls. Then the CDC checked back with the children's doctors to confirm whether they indeed had been vaccinated. Overall, U.S. vaccine rates remain high outside of these pocketed clusters. About 90% of those surveyed got the recommended vaccines, such as the